Dr. Aron, Australians often cannot find local solutions to their problems. When they reach out to you, what do Australian patients think is missing in their home country to receive the care they need?
Well, my experience is this, and this is a consistent one, that my special interest and dare I say, area of expertise is treating atopic skin disease, which, as you know, is a form of very, very severe eczema. And the majority of the patients have received conventional treatment, so-called standard of care treatment, but the cases that present to me are presenting with significant secondary bacterial infection via a bacterial germ called Staphylococcus aureus. So if this Staph aureus germ is not vigorously and effectively treated with appropriate antibiotic therapy, and the area of antibiotic therapy in atopic skin disease is a very complex one, the eczema never gets better consistently over an acceptable period of time. So what I find is that by treating and understanding the presence of infection and the implications thereof, I can get very favorable results in a very high number of patients because if you get rid of the infection in the skin, as you would in any other organ, the patient is going to look and feel very much better. And that will give an opportunity for further investigation into the allergy side or the food allergy side of this so-called atopic diathesis. In other words, the makeup which includes asthma, eczema, hay fever, conjunctivitis, and rhinitis. So if you can combine appropriate topical therapy with appropriate and well-focused investigations in regard to gut health and diet, you will then have a wholly integrated and very healthy child, so I believe.
Dr. Aron's protocol is internationally known, even in former Eastern European bloc, for being highly successful in managing eczema and overcoming challenges. When you talk about gut health, Dr. Aron, why is now everybody emphasizing gut health? What is it about gut health that can help us overcome skin conditions, food allergies, and other atopies?
Well, you see, I believe the Orthodox profession, including myself, for many years saw the skin as an independent organ. But I think we have now come to realize, or at least I've come to realize, that the skin is not an independent organ. It is linked with all the other organs in the body, including the gut. So you can get good results by treating the skin appropriately, but it doesn't make sense that one should ignore gut health. So the complementary aspects of improving gut health and clearing the skin from the outside, so to speak, will certainly give you the sort of healthy child that we are all seeking. So the two are supplementary, they are complementary, and should not be separated artificially by medical dogma. And let me say once again, I was a protagonist of medical dogma for many years, but I have seen the light.
I love that. What is, in a nutshell, Dr. Richard Aron's protocol?
Well, basically, it's a combination of a topical steroid cream or ointment, which is central to the management of eczema, diluted in a moisturizing product so that the potency of the steroid can be readily monitored to reduce the potential for steroid side effects, such as skin thinning or systemic absorption. But here is the kicker. It is the addition of an anti-Staphylococcus aureus antibiotic into the combination of the other two products, which makes the huge difference, because the antibiotic, which is either usually fusidic acid cream or the Pyrrhicin 2% cream or ointment, that kills the Staphylococcus aureus. It then enables the steroid component to work more effectively, and you can then continue with the treatment because of the reduced potency of this compound indefinitely. And you must remember that atopic skin disease is a chronic disease. So to start treatment and then stop it when the patient is better is manifestly wrong. And if I may be so bold to give you two equivalences, if someone has high blood pressure and you give them the medication and the blood pressure comes to normal, you don't stop the treatment then, because obviously the blood pressure will go up again. And another similar and common situation is in a diabetic patient. If you treat a patient successfully with diabetes, you may modify or moderate the treatment, but you will never stop it completely, because if you do, the sugar levels will go sky high again. So it's always been a puzzle to me how orthodoxy can advise that you treat a patient with chronic disease, with chronic skin disease, and when they're better, you stop the treatment completely because of fear of side effects. There's something wrong there.
That is a fantastic point. As all the parents will probably ask you who have children with atopy of the skin, in your opinion, do you observe any trends? Why are we faced with this global problem?
Not really. I think no. The answer is I cannot see a trend. You may have to edit this. I cannot really see a trend. I think there's increasing recognition of the benefits of combined antibiotic, steroid, and moisturizer treatment, so-called CASM, CASM. I think that's being adopted more and more widely, but the use of this simple, economic, effective product is contrary to the current narrative in the management of atopic skin disease, whereby treatments with immunosuppressive drugs and monoclonal antibiotic drugs are the sexy approaches of the day. CASM and using out-of-patent products, which are very, very cheap, is not a sexy narrative. It works, but enough said on the subject.
In terms of your future plans on this front, do you have a vision to write a book, or how do you share your knowledge with the world?
Well, I have a New Zealand journalist, a mother of a child that I've treated, who is in the process of writing an ebook. And I think that will spread far and wide, the word of the Aron Regimen. In regard to my own plans, I plan to continue working. I do find the pressures of work wearing on me to some degree, to be honest, but I have the support of my beloved wife, Kate, who runs the administrative side of my practice. And I would also like to acknowledge the many and varied parents who started my Facebook page, Dr. Aron's Eczema Treatment Discussion Group, on which we have no fewer than 92,000 members. I will be meeting with some of the mums in Sydney later this week, which is going to be a pleasure. And this is a moment to acknowledge the countless mothers and a few fathers as well, who have given willingly and unstintingly of their time to promote the Aron Regimen through social media. They have done an incredible job, and they continue to do so. So huge gratitude and huge acknowledgement and huge thanks to them.
And we also thank you for being here, for making the trip to Australia to see your former patients, to see the doctors you have been working with. Thank you for being with us today. And I hope that our listeners will reach out to your website and your social media pages and learn as much as they can and then implement your regimen.
It's been a pleasure.
Thank you.